Well, I'm joined now by Dr. Chaand Nagpaul, who's chair of the British Medical Association. We're also hoping to be joined by Lord Woolley, the advisory chair of the government's Race Disparity Unit and founder of Operation Black Vote. But first, Dr. Chaand Nagpaul, good to talk to you. You raised this as an issue. How quickly did you realise that this was something that was affecting your black and ethnic minority colleagues?
So early in April, in fact, on the 8th of April, I called for an inquiry because the first 10 doctors who had died were all from a BAME background. We now have seen more than 200 healthcare workers die, of which about 94% of doctors who've died have come from a BAME background, and about 2/3 of all healthcare workers have come from a BAME background. So these are staggering figures. They're not explainable in terms of variation. And what this report has, of course, reiterated is just how much damage it has caused in terms of ill health and deaths in the BAME community at large. Now, we knew about these issues, as I said, right back in April. The report hasn't, unfortunately, gone further and spelt out what needs to change to protect our BAME community.
So essentially you're saying, you know, it's all well and good, this report has confirmed what we suspected, but it's not given us really any information that we can act on.
Yes, and some of this information has come out of other organisations such as the ONS, and it's showing that there are some categories of BAME people who are more at risk. In terms of key workers, it's showing, for example, that people who are taxi drivers, public transport workers, security guards, shop assistants are at great risk. But then it hasn't gone further in recommending what needs to happen to protect those workers, of which a larger proportion are from BAME communities. So if a report says that if you're black, you have a 4 times greater risk of serious ill health and death if you contract COVID-19, then of course what a person will be asking is, well, what does that mean for me? What needs to be different for me? And I think that what's critically important is to put in place actions to protect those at greatest risk in the workplace. And as a doctor, I'm speaking on behalf of doctors and other healthcare professionals when they go to work too.
I mean, when we look at what happened at the very beginning of the outbreak and when the lockdown started, pregnant women, those over 70, those who had life-changing illnesses were all told to isolate. If you're black and you're 4 times more likely to die if you're a black man, shouldn't that also be extended to all of the people in that group also? And shouldn't they be removed from frontline care?
Well, it's not as simple as that because it's you have to look at risk of individuals on various factors. So if you are, let's say, 60 years of age, and that puts you at high risk, and you're male, and you have diabetes, and you're of a BAME background, that's high risk. And yes, on behalf of the doctors I represent, they should not be in that situation, be treating patients with COVID-19, because if they were unlucky enough to be infected, that puts their own health and their life at risk. However, if you are someone who is at a young age with no other risk factors, that assessment may allow you to carry on working in a different environment. So it has to be individually risk assessed, and we don't have that in place across the piece. And if you're a worker, if you're a key worker, and you're working in public transport, and now that people are using trains and buses more frequently, surely you should deserve some protection to make sure that you are not exposed to the virus. If you're working in a busy supermarket, you should have adaptations because you can't socially distance, to make sure that you are shielded with a perspex screen and maybe have a mask and other measures. That's the sort of workplace assessments that need to be taken, need to happen to protect our workforce, especially if you come from a BAME background. So that's what the report hasn't described.
And also thinking more specifically about the NHS, if all the people who were of a black and ethnic minority background working in the NHS were told, actually, you are at greater risk, you shouldn't be front-facing, you shouldn't be dealing with patients with COVID, what impact would that have on the NHS? Could it operate even?
Well, in fact, we are now pushing for risk assessments, and those doctors and healthcare workers at highest risk, should not be putting themselves at risk. And in fact, this doesn't mean that they're not able to provide frontline work. The NHS at the moment is trying to cope with a huge backlog of patients who are not COVID. And many of those patients can be seen by doctors and other healthcare professionals who are in the risk category. So they're not doing COVID-facing work. There's significant amount of work that can be done remotely by video consultation, for example. So it's about redeployment and reducing the risk on individuals that needs to be the priority. It's not that people have to stop working.
Really good to talk to you, Dr. Chaand Nagpaul. Just one last question before we go. I mean, you're obviously, you're a doctor. You've worked in medicine for a very long time. What is your instinct telling you? Why do you think those who are black, male, or of Bangladeshi origin are more likely to be affected?
What I can say is that there won't be a single answer, because we've also got differences between the different ethnic groups, with the black Africans at higher risk than some of the Asian groups, and even within the Asian groups, there's differences between Bangladeshis, Pakistanis, Indians. So we know that this is something quite it's not a single answer, but we do know that some of the underlying conditions that put you at greater risk, like diabetes, heart disease, hypertension, are at higher prevalence amongst the BAME population, which is why we need to do those risk assessments. We also know that in certain cultural factors in the workplace mean that if a doctor feels they're not adequately protected with personal protection, we know that sometimes doctors from a BAME background are less likely to challenge, speak out, and you'll be well aware around the shortages around PPE in the last 2 months. So we're concerned about people not having the right protection or speaking out and challenging it when they feel unprotected. I think there are going to be other factors around the actual ethnicity itself being an independent risk factor, and that's what the statistics are showing, that actually the status of being BAME puts you at higher risk. And of course, there are going to be other factors in the community. We know that not so much for healthcare workers or doctors, but those that come from deprived backgrounds are more likely, twice as more likely to die of the illness. So when you look at the community, those sorts of circumstances need to be factored in. Overcrowding, 30% of Bangladeshis live in overcrowded housing compared to 2% of white population. So that puts people at much greater risk and spread of infection. And so in some of this is actually bringing to the fore inequalities we know that existed before, but COVID is just exacerbating it. And these are the sorts of actions we need to be taking to tackle this differential effect.
Dr. Chaand Nagpaul, thank you very much for joining us to discuss it. We unfortunately couldn't get Sir Simon Woolley